ADHD is not merely about having trouble focusing or being overly active. It is a complex illness that involves variations in the growth and operation of the brain.
Okay, let's go.
Hello, everyone, and thank you for listening to Coaching to Change. This podcast is coming to you either by streaming on one of your favorite streaming channels, iHeart, Apple Podcast. We're on all of them, so thank you for listening. And or you could be watching me on YouTube. But I want to say that today we are going to discuss ADHD, or better known as Attention Deficit Hyperactivity Disorder, ADHD. So if you are familiar with this, it's probably because you probably have it, or somebody accused you of having it, or you know someone that has it, or basically you accuse another person of having it. We kind of use it as a joke because when people tend to seem to have a lot of energy, we typically use that as a way of trying to justify what it is and why they do that. But it is an important factor. It is something that impacts mental health. It is something that impacts us every day. So it is important that we kind of go over this and discuss it because there are people out there who are experiencing it or don't even realize they're experiencing it. So, as you know, I am, a coach, a master coach, focusing on mental health. And I would agree in most cases, my job is relating to supporting others developmentally, mentally, and that is what I put my attention on. I've been coaching for about a decade, and I started to identify some flaws in some of the things that I was being taught with coaching, and that was a problem for me. So, you may say it is usually the coach and not the program, and I would agree with you in most cases. However, did you ever stop to think, if a coach is so good, why does the person continue to need him or her? Think about that for a second. So there lies my purpose of developing a program called Mastery in Life. And it is a method, and it's nothing new. I mean, I've created and manifested and put this into place, this methodology, if you will. However, there's a psychologist, a famous psychologist named Carl Rogers, who started this way back when, and I have just simply, from all of my studies, have modernized it, if you will. Now, before you think I'm just some guy who created something else, again, this is not something that's new. It's like, we basically see when you have a particular type of brand, you see another brand comes out. Somebody will find something else that they want to do, and it's very similar. The thing is, though, I am trying to give back the power to the client. I'm not looking to keep the client as my client. That's not the point. So the foundation of the Mastery in Life method, it comes from giving power back. And that's what I was trying to understand, why more coaches do not do that. When Dr. Rogers wrote this book, somewhere over the years, we lost focus somewhere in there. And this coaching revolution has been kind of evolved into this money-making thing. So, in my opinion, somewhere between the evolution and greed and trying, I don't know. That's not the point. So anyway, let's discuss ADHD. So this is a neurodevelopmental illness, and this is why I'm so passionate about it, because as a developmental health coach, developmental is the key component relating to mental health that I like to focus on. So this ADHD, or attention deficit hyperactivity illness, it is an illness, affects millions of adults and children globally. Okay, so again, understand that this is not something that's new. It's not something that's rare. It is definitely an impact all over the world. Most people recognize it because you notice certain symptoms like hyperactivity, impulsiveness, and there's another one that most people do not give enough attention to, ironically, is lack of attention. So I find this interesting because historically you will have someone in, say for instance, in your classroom, and they're acting up or they're not focusing, and we assume that this student is a bad student, doesn't care about schoolwork. But we don't really recognize and try to focus on why that is. In many cases, either the kid has ADHD, or they're just very, very intelligent, smart, and they're bored. I've seen that on many occasions. ADHD can have a big influence on job and academic performances, productivity, relationships. It can impact your overall quality of life. So, despite its prevalence, ADHD remains misunderstood, and the worst part is that it's often stigmatized, and that's probably the problem I have the most. So we're going to talk about this a little bit, understanding what ADHD is. Because if you're listening, and if this is a particular podcast that's interesting you, this is definitely something that's important for you to understand, because it is a chronic condition, and you can identify it early in the childhood, okay, and it can continue from childhood into adulthood, and it affects how people pay attention. Controlling your impulses and managing the energy levels. I mean, it affects how they're able to do these things. ADHD is not merely about having trouble focusing or being overly active. It is a complex illness that involves variations in the growth and operation of the brain. Now, I will not and will never go into the details of the brain, because in my second book, I talked about how complex the brain is. That book right there, and I will never try to challenge, nor should anybody try to understand such a complex muscle. The brain has such a complexity to it that it will always be something that we're going to continue to study and try to understand. Meanwhile, let's focus on what we do know. Because ADHD is something that we see and needs to be provided assistance with, and that's why we have to kind of talk about what that is. What are the dominant symptoms? From my studies, there's three dominant ones, and one of is inattentiveness. Just being able to, appearing forgetful, easily distracted, struggling to sustain attention when you're told to do something, you're involved with something, and you just have a hard time maintaining that. Another one is hyperactiveness and impulsiveness. That's what we most commonly used to seeing, and that's when people just, you just move very quickly and behave impulsively without thinking through most importantly, the repercussions. Why would you do that? Why is, you can hear a parent scolding their child, and that person will just do it without thinking, or interrupting others frequently. I had a client, and I actually think I did a podcast on it. I actually talked about this particular client and her ability to, it is an ability, but for her to constantly interrupt me when we're in the middle of a coaching session or conversations. She consistently interrupts me frequently and having trouble waiting for her turn. And that was a challenge for her because she didn't even notice she was doing it. And we would work on different things to help her understand how to manage that, like being able to process what I'm saying, wait your turn, let's do a give and go. These are things and techniques that you can, if somebody's willing to learn and understand. But unfortunately, it's not very easy when you have ADHD. Another one is, combined presentation, which is the most common type, is where individuals just exhibit significant symptoms of both inattention and hyperactivity. So the combination of both of those could be a problem. I can only imagine a child in school having to have that and nobody's aware. But I think our school systems are pretty good now in this day and age to identify. A lot of our teachers are familiar and aware. Our schools have, on-site psychologists, and they typically can put pieces together to start to recognize what it is that these students are starting to experience, and that helps. But symptoms of ADHD can vary, from person to person, and may change over time. The inattention and the combination of the impulsivity, even though those are two primaries, sustaining that attention, struggling to stay on task, being able to, having to repeat and require sustained mental effort, those are really challenging. That contributes to disorganization, keeping track of those tasks, managing their time, organizing activities. Those things are difficult. I know my client mentioned that she has a hard time doing her budget, her bills. Again, that could be the part of the disorganization part. But then again, you can also be forgetful because you forget the tasks such as paying the bills or keeping appointments or completing assignments. Because why? Well, because you can get easily distracted. So the distraction is another component. External stimuli or unrelated thoughts, making it difficult to stay on task. All of these things, cycle and come around full circle. Avoidance of tasks because it requires focus. So somebody chooses not to do it because they know it. Having that ability to recognize your shortcomings, tasks that require prolonged concentration, such as reading or completing forms. So what happens if you're a student in high school and you know that you're having a hard time reading that required assignment? What do? You don't do it. You end up getting a bad grade. And then we know what goes from there. So that's when you have again, one of the components of inability of being able to focus. But what about the hyperactivity part, the impulsiveness part? Somebody like that, I remember when I say this word, I can hear in my head a grandmother or a mother or aunt saying, "Stop fidgeting." You ever heard that before? The constant movement, tapping your hands, your feet, squirming in your seat. Can you imagine a student in school doing that on a regular basis? This is part of hyperactivity. The inability to stay seated. Individuals with ADHD may have trouble remaining seated, and sitting is expected. If you're in church, if you're in class, this is what they want you to do. So again, if you're in a meeting, I can only imagine if you're somebody who's has still suffered from this, and you're in your 30s and you're constantly moving around and at work, and your boss constantly is looking at you because he or she is distracted. I don't have ADHD, but I'm doing excessive talking right now because I'm doing this podcast, and I don't want to keep you for hours and hours on this topic, but that could be considered a component. Talking excessively, often interrupting others, blurting out answers before questions is asked. Again, I talked about my client. That's what she did on a regular basis. Then you have impulse actions, acting without thinking, making hasty decisions, taking unnecessary risks. Those are also components. And then I would also say, if you're going to really consider these things, understand who the person is. We try not to be judgmental, but because we recognize that a person is suffering from something. So when you can see the combinations of this and you recognize it by listening to this podcast, these are the things we want to start going, okay, wait a minute, I'm starting to recognize these things. Somebody can't seem to wait in line. Why is it that they can't stand in line and wait their turn during activities, or they get anxious? These are all symptoms. And I don't mean to focus on just the flaws and the challenges, but it's important to recognize. It really is. So where does it come from? ADHD has some causes, an exact cause of it. ADHD is, the research, and not me, not Dr. Bryant, the research indicates that it probably caused by a mix of genetic, I always get that word wrong. Neuro, neurological and environmental factors. So there's the brain and your cult, your society, the surroundings. While that is a cause, we don't really know. So let's talk about the neural part, the neurological part, where it could be some sort of genetic factor. Does it run in a family? I don't know. According to studies, kids have it. Parents, siblings are more likely to get it. Children will have it because the parent has ADHD, afflicted parent. Ah, okay. Research says that specific genes related to, dopamine and regulations, which affects attention and reward motivated behavior, have been implicated to ADHD. Again, this is research. As a coach, I want to understand how to manage that relationship with my client and maintain that level of engagement without losing their interest. So if I start to detect and realize that my particular client is definitely, with that illness, I need to figure some options. Remember, as a coach, it is my responsibility to ensure that my client can reach their full potential. So if I'm starting to recognize that one of their shortcomings is related to having ADHD, then we got something that we got to deal with. Because we're talking about neurological factors, we're talking about environmental factors, but again, that makes things a little more complicated, and we can't really get into that on this show because that's just quite a bit, and it really is going to get specific. So this is more of a one-on-one conversation to assist somebody to fully understand that impact of their condition. However, this show is about trauma and mental health. So on that note, we're going to talk about the attention deficit disorder and trauma, and we're going to really get into that a little bit more because I want you to leave this show understanding that to some point. So let's, to be able to realize and recognize this, you got to understand how trauma plays into this, because ADHD is often associated with genetic factors and neurological differences. Okay, so the emerging research right now suggests that trauma can also play a significant role in its development. So traumatic experiences, particularly during childhood, can disrupt the normal development of the brain, leading to symptoms associated with ADHD. So these experiences can include physical, emotional, sexual abuse, disregard, losing a loved one, exposure to violence. I mean, when I researched this stuff to learn so I could be able to educate others in my psychology courses, it's interesting because I always just assumed ADHD was something that somebody was born with. I didn't realize there was an impact of trauma related to it. So when you're talking about, cognitive and emotional things, trauma may lead to heightened anxiety, depression, difficulty managing stress, which can compound the challenges of living with ADHD. And that's what I focus on, is these areas. Behavioral challenges, the overlap of trauma and ADHD, that can lead to a cycle of negative behaviors and reactions. That further is going to isolate an individual and hamper their social development. So, you got the behavioral challenges, you got the cognitive and emotional challenges, and then there's, of course, the academic and occupational difficulties. So you're a 30, 40, 50-year-old person. Now you got the stress and emotional turmoil resulting because you got trauma that's still unresolved, and you make it even harder to concentrate. It's hard to stay organized, and you have deadlines you have to meet. You're not be able to meet it. You can't focus. Your attention is not there, potentially leading to underachievement, and therefore impacts your job stability. So, as you can see, all of this stuff, it kind of ties into each other. It makes it very difficult. So diagnosis of ADHD is really what we need to figure out and do. So that could be challenging, because when there isn't a single test that can actually identify the condition. I have discussed this on other podcast shows and my previous book, that the brain is complex. So here, what are the perspectives? What are we looking at? So clinical interviews. Okay, so these interviews are intended to obtain what data, comprehensive data, so we can understand the person's behavior, understand their history, understand their symptoms. Okay, clinical interviews. All right, check. What about behavioral assessments? Okay, these assessments help compare. Let's compare the individual's behavior at typical age related expectations. Okay, I can understand that. And remember, everything I say, these are things that are being done. These are things that are being applied. I do understand that they have a purpose. I'm definitely not contradicting it. I just kind of, for me, I feel like sometimes and maybe I'm a little tainted because I've gone through a lot of this, is that I feel we just go through the routine sometimes. Um, the research also talks about observation, direct observation of the person, in various contexts, so, and that I totally support, because how else are you going to recognize and understand it? So you got parents at home, you got the teachers at the school, you got, if you're at work, you got peers at work, your best friends, your co-workers, they can provide valuable insights if they understand how ADHD symptoms work. ADHD symptoms manifest in your daily life. So hopefully people are paying attention. Hopefully they're not being judgmental and just assuming that you're just a bad employee or a bad student. And there's also medical. You have medical evaluation. There's physical. If the parent recognizes something's not right, or you're feeling like there's something there, you have all the personal motivation to want to do a good job, but you're just struggling. Well, the physical examination, let's look at your medical history. Let's understand how, you got to this point, because we want to rule out all of the conditions that could mimic ADHD, and that is true. It is very true. So let's try to eliminate these so we can focus on these. Sleep disorders, anxiety, thyroid problems. These are all things that could give us some sort of guidance. All right, so if we get to that point, there's the management of it, the management and the treatment. And I'm sure some of you are like, yes, this is what I really want to understand. I know I have it, or I know my friend has it. I don't need to hear about that. Tell me what we need to do. Okay, so we understand that this is a chronic condition. Okay, so it is necessary to have appropriate treatment and management strategies in place. Individuals with ADHD can lead successfully and fulfilling lives. That goes without saying. Behavioral treatment, cognitive behavioral therapy, medication. Much as I hate to say that, medication, and there's also lifestyle adjustments. And I will not go into that, not now, not on the show, because there's so many of those things, but those things are something you could definitely research or contact me later, and I would be more than happy to walk you through that. But let's talk about what is, something that we can kind of focus on. That's behavioral therapy. Because that's usually the most common line of therapy, especially for children with ADHD, because this kind of teaches the child, or teaches the person and their families, believe it or not, the strategies to managing this particular symptom. How do we improve the behavior? How do we cope with the challenges of ADHD? Okay, so I mentioned CBT before, cognitive behavioral therapy. I mentioned that on another show. I think it was substance abuse. It helps individuals develop the skills, manage the impulsive behavior, improve organization, build problem-solving strategies. My favorite, parent training. This is teaching the parent, and it is recommended, obviously for adolescents and children, but these programs will teach parents to reinforce the positive behavior. You do this by setting clear expectations, and you're using techniques of discipline. Now, I say this with the utmost caution, is that be careful. I mean, again, this is considered to be an illness, so parents, just be mindful of how much discipline you're applying. Be mindful that this is an illness that we're dealing with, and that particular adolescent is, may or may not be able to truly understand, comprehend, and understand what's going on. So it needs your ability to work with them by setting clear expectations, but be mindful of your attitude, your escalation of voice, and all these other things that could, cause more damage and make things more detrimental. Social skills training is another one. This therapy helps individuals improve their social interactions. You're teaching them how to, like, identifying, different clues, or reading social cues and responding appropriately. Like I told you with my client, it's like, let the person finish talking, think about what they said. And even like, it's like kind of like an interview. I said this, if you're doing an interview, I've always, when I was a manager, executives, etc., but I always tap back into when I was an employee. And one of the techniques I was taught as an employee, and which I have taught my employees years later, is when you're in an interview, repeat the question. When somebody is asking you a question, process it, think about it, repeat the question, and then you respond. In fact, I think my father's the one who taught me that. As I've gotten older and older, and more challenging roles of responsibility, I got to the point where I started writing down the questions, because depending on the role, it can be quite complex. And, a lot of these hiring people would throw out more complex things. So again, nothing wrong with that. But in this relationship here, with somebody struggling with ADHD, learning how to repeat the question and responding appropriately will definitely assist in developing better communication skills. Therefore, you're not turning people off all the time. And of course, there is definitely medication, which I, don't want to get into. I don't even want to talk about that at all. But the treatment of ADHD in the context of trauma, yeah, that I want to talk about. I want to circle back to that, because mental health is something I'm very passionate about, because I have a feeling most of my listeners are following because of that interest for whatever reason. I know I have a lot of veterans, first responders, etc. So in my coaching profession, I focus on these developmental stages of mental health. And that is why I coined the term developmental health coach. That is who I am. And I created this mastery in life method to discuss how we can focus on the tools of a person and identify their strengths. So when you talk about trauma-informed therapy and addressing the trauma, that is crucial in affecting the treatment of ADHD. So again, I don't want to get into the clinical stuff, but cognitive behavioral therapy, which I mentioned before, we can help process and deal with those strategies, the coping strategies, addressing the root cause of trauma. The therapy can alleviate some of those symptoms and help with the experiences that person is going through. Mindfulness, stress reduction techniques. These techniques help individuals develop greater self-awareness, emotional control, the capacity of present moment living. That is amazing. And that can mediate, some of the trauma-related symptoms. And again, holistic and medication, but we're going to move on. I just don't get into that, because medication is definitely... if you follow me, I'm not a fan unless it's absolute last measure or resort. But without others' involvement, someone may be asking, what can I do for myself right now? Well, there is something. You can do lifestyle adjustment. I am the first to tell you I'm horrible about this. This falls into some of the holistic areas. Apart from counseling and medication, specific lifestyle modification can help manage ADHD symptoms. So frequent exercise, okay? Get a routine, incorporate your exercise. That could be beneficial. Healthy diet, balanced diets with fruits, vegetables, grains, lean meats, all those great things. Research has shown that reducing your sugar and avoiding all those artificial additives, that can help reduce ADHD symptoms. Sleep hygiene. What I mean by that is just a regular sleep schedule that can help you sleep better and generate a relaxing environment. If you struggle with sleeping, reach out to me. I got some great techniques on that as well. And again, time management techniques. Use a planner. If you struggle with being able to get distracted and all that, use a planner. I remember, I regret that years ago, when I used to work for the state government, I remember that one of the things we would get when we were hired was those Franklin Covey planners. Oh, I love those things because we didn't have Microsoft calendars and all that, so we would use the planners. And it was amazing to have that. So utilizing your calendars, now you have your phone, you can do that. I use Notes, I use Siri, and I tell her to remind me things. So there's all sorts of apps out there to organize your tasks, set reminders. I mean, I got Alexa all over my house, in my living room, my bedroom, my office. I think the only place she's not in is bathrooms and the kitchen. And basically, I just, tell her to remind me this, tell her to remind me that. And you'd be amazed at how much you forget. I wish I had her when I get my weekly massage, because while I'm laying on the table, it's like I think of all kinds of things, and I wish I could just tell her to remind me of this because ideas come to my head. But my point is, time management can help you with ADHD because it allows you to stay on course and allows you to deal with your responsibilities effectively. All right. So, our adults are not exempt. I've been talking a lot about students and all that, but even because they are mostly related to children, because adults have some sort of component that they can try to manage a little more. But it is increasingly being recognized in individuals at adulthood, because you'll see it in their job performance, relationships, and their daily functioning. So they can benefit from some of these treatment strategies, behavioral therapy, medication, lifestyle modifications. And by the way, you have the option of having some of these accommodations available to you at your job. So if you are diagnosed and you have obviously doctored information to be able to justify it, you need to go see your HR, and you can be able to get certain accommodations at the workplace. So ADHD may need specific accommodations. You may have to have flexible deadlines, quiet workspace, using organizational tools to help you succeed. Like I mentioned, we were given Franklin Covey calendars back when we had a job. They didn't even realize that what they were doing was simply giving us tools to help us succeed. And that's exactly what ADHD diagnosed individuals may need. When I teach at the university, whenever I have a particular student who is on IEP, and this will be a component of that, and I have to adjust their deadlines. So where my class would have an assignment due on Thursday, this particular student will get the following Monday. And there's nothing held against them or her for that reason because of that IEP. So again, workplace accommodations is the same thing. Relationship counseling, because that could strain a relationship. You forget your anniversary, you forget to pick up a child at school, you make impulsive decisions, you don't communicate well with your significant other. These are things that could impact the relationship. So yeah, maybe you want to consider some techniques. So counseling, couples therapy, again, you have to figure out what we can do. Go back to some of the other components I said and figure out what you can do to get yourself some of the techniques to start improving your lifestyle. So it's not an easy thing. The strategies behind this, the diagnosis, the treatment support is not easy. So all in all, ADHD is a complicated illness with so many facets that calls for an approach of diagnosis and treatment. So you got to understand the symptoms and the causes. You got to figure out how to manage it, and the crucial of these effects and who's getting impacted. If it's work, your family members, you got to be able to take control. ADHD presents significant challenges. It is important to remember that with the right support, you can lead a successful life. I've mentioned that. whether, behavioral therapy, medication, lifestyle adjustments. I mentioned all that. So, I choose for the motivational factor because I coach for the motivational factor because I believe every person has the will and capability of improving and reaching a goal. So, however, being able to identify how that is the key. So again, I go back to explaining how Mastery in Life method provides a personal dissection to give each of you an opportunity to understand yourself. We leverage the tools that you already have. So if you're interested in taking your life back, you should enroll in that next course. It's about 48 hours, 9 modules, and you can learn all the techniques that you can take with you every day. Every day you'll be able to utilize and leverage. You'll be able to understand how to use your tools and maintain the knowledge. Be able to help yourself. You can help others. You'd be surprised at how you would perform. So these techniques are nothing new. It's been talked about in psychology for decades, but I've modernized it to be able to give it back to you. So I hope this was helpful. I'm glad you're here and you listened to this point. Again, my name is Dr. Aaron P. Bryant. I am your host for Coaching to Change. And if you're alone, sad, worried, depressed, or you're just feeling like you are losing control, like I do many times and often, remember, someone is always listening, and that someone is not just me. Thank you for listening or watching. I appreciate you. Take care.